All right, good morning. If I could invite those of you that are standing to come on in and get a seat, we'll get started. So good morning and welcome to the 29th Annual ITUP Conference. We have a great program that's planned for today and lots of opportunity for networking. And you saw the signs reminding you to take advantage of that and getting to see colleagues and meet some new individuals. And what we have is an agenda that is packed with experts and leaders from across California's healthcare sphere. My name is Sunita Mutha. I chair the ITUP Board of Directors, which is a great pleasure. I want to show you on this next slide that I want to call out my fellow board members, Jonathan Friedman, who's the board treasurer, Robert Phillips, who's the board secretary. And when I finish reading these names, I'd like to invite those who are here to stand up and be recognized. Lupe Alonso Diaz, Marian Mulkey, Patrick Johnson, and Ceci Oregon. I'd like to invite you to just stand up to be recognized. All right, now please join me in welcoming Crispin Delgado, our executive director.
Good morning, everyone. How are we doing? Yeah? Thank you for being here on a rainy day. I hope that the commute wasn't too bad. I also want to start off by thanking the ITUP board. I've appreciated working with you for the past 2 years. I would also like to thank my staff, my team. I know that they're out there. All of this would not be possible without them. And lastly, thank you for making the trek out to Sacramento in the rain. But it's a critical time for us to get together, for us to be in community and talking about the issues that we've highlighted for you today. And a couple of things. There's some logistical things, and then I'll do some presenting as well. The welcome slide. So here, you'll see this, and it's also on the back of your badge, is for you to get connected. So today, I'm hoping that you're using the app for the event. A lot of resources are in there. As you'll learn later, we're also doing a few games that have prizes at the end of the day. And it's really a great way to engage and to meet other people. So all of the attendees are in there. And we encourage you to use it. And during the day, you'll have to use your phone. This is a good example. There's going to be QR codes. There's going to be a Mentimeter during lunch. So I do ask that you put it in silent mode, but keep it handy. And before we begin, I would like to highlight that ITUP is utilizing the platform Wordly today to provide real-time translation and transcription in multiple languages. You could scan the QR code on the screen to utilize this new feature. We recognize that not everyone here speaks English, and so this should be a way for you to plug in and listen to the conference live in whatever language you choose. Next, I want to acknowledge the indigenous land that we are standing on. Sacramento's history is deeply rooted in the heritage, culture, and traditions of its first peoples. This area remains the ancestral homeland of the Nisesan people and has long served as a gathering place for tribes throughout the Central Valley and foothills. We recognize the southern Maidu people to the north, the valley and the plains Miwok, and peoples to the south of the American River and the Patwin Wintu peoples to the west of the Sacramento River. We also honor the Wilton Rancheria, Sacramento County's only federally recognized tribe. We are grateful to be in community on the tribal lands of Sacramento's indigenous people. We also want to acknowledge that much of the nation's foundation, its economy, culture, and development was built on the labor of enslaved Africans and their descendants. They endured the horrors of the transatlantic slave trade, chattel slavery, and systemic oppression through Jim Crow laws. Their sacrifices shaped the country we know today, and the echoes of that history remain evident in the disparities that we see today in healthcare. And so I want to acknowledge our Black history, especially Black History Month. So we'll take that moment to recognize them. Next, and I think that this was the slide that was actually up there. Yeah, our hearts go out to our LA community. I would like to just take a moment to send our best wishes to everyone down there that experienced the devastating wildfires. I know Altamed lost a full clinic, and so our hearts go out to the clinic staff and the community of patients that it serves. The Los Angeles community is strong and resilient. And as a government and a nonprofit leader in LA, including CCALAC with Louise, they're jumping in to support their communities. So let's also try to support them. In the app, you will find a donation link in case you're able to donate to those efforts, because it's gonna take a long time to recover, and we have to make sure that our people down there are safe and have a place to go access care. So next, what I would love to do is find out who's in the room. And yes, this will be a yelling contest to see who wins. But you know, I know that we have people from different backgrounds. So do we have any elected officials in the audience? I can't hear you. Okay, there must be some. Healthcare providers. Thank you. Sunita, I don't know, I didn't hear you, but you're there. Health equity advocates. Yeah, okay, there we go. We're awake. Clinicians. Thank you. Our cherished sponsors, donors, and grant makers. Yeah, thank you. Thank you so much for being here and for supporting this event. How about, let me see, who else? Oh, my favorite. The future public health leaders, our ACC graduates, undergraduates that are here, students. Make yourself heard. Yeah. A little louder, a little louder. Yeah, you guys are the future. And, you know, as you look around, and hopefully everyone in the audience can look around and identify them, if you have time, talk to them. I know that as a first-gen person going to college, establishing my own network was hard. And one thing that is a huge benefit at this conference is we come in community and have a common purpose. And that's that every Californian has access to coverage and to care. So if there's any lessons or connections you can make with these young leaders, I encourage you to do so. You are an invaluable partner in this work. We deeply appreciate your commitment. We see you, we welcome you, and we thank you. And as one of the leading health equity conferences in California, it is also our honor to convene and host all of you. I'm excited to jump into the topics and conversations that we have put together for you. But before I do that, I want to give you an extra special welcome to first-time ITUP conference attendees and provide a bit of background about ITUP. But before I do that, raise your hand if this is your first time, your first ITUP conference. Oh, wow, okay, great, welcome. Don't be shy to ask questions. You've seen our staff outside. We're happy to help you navigate. And again, the app is a good tool. So let me talk a little bit about who we are. So we're an independent 501c3 nonprofit health policy institute here in Sacramento. And although we're based in Sacramento, we do work all over the state. For nearly, actually 3 decades, we've provided expert analysis and facilitated convenings of California health leaders around the state. And we also focus on workable policy solutions to expand access and improve healthcare in California. Our goal is to tell the story in a way that's accessible, de-wonkified, if you will, to understandable formats. We want everyone to understand what's happening at the state level and even now at the federal level, and how does it impact our work, and how does it impact the communities that we serve. And so we're driven by our values. We believe that healthcare is universal. We believe it should be equitable. We believe it should be accessible, effective, and affordable. I know so many people, myself included, you know, I was born in a public hospital. Our first source of healthcare was a community health center that my mom used to walk us to. And yeah, my sister's here, who I love and adore, so she's a first timer. I hope you raised your hand. But you know, we understand what it's like to be uninsured, and we also understand what it means to engage with the health system. And so this is our vision and the values that we lead with. Some of what we do here at ITUP, the way that we do our work, are first, we have this conference annually. Like Sunita mentioned, this is the 29th year that we've been doing it. So next year is a big birthday, a milestone birthday. We also do health policy publications. Like I said, we de-wonkify the things that are happening in Sacramento so that they're digestible and you can understand them. You know, some of these toolkits and fact sheets go to the regions, and not only do they give you a sense of who is still uninsured in your community, people also use these fact sheets to go to their board of supervisors, to go to their city council and share it with elected officials to say, these are the people we need to work for. These are the people that we need to help. And from what I've heard too, people utilize those fact sheets in their grant writing. So I encourage you to think about that next time you see the publications. And if it could be helpful for you for your development, please feel free to use that data. We also hold 11 regional health equity collaboratives. We do these throughout the states. I know I saw a lot of familiar faces as I was grabbing some coffee. Thank you to those that participated. Yesterday, we led our pre-conference and shared some of the findings from those 11 collaboratives. And that is a great way for us to understand what's happening at the ground level. You know, as we do the work with the state government, we share that information with our community, and then we engage our community, and we lift up those findings and share it with our state leaders. So we sit in the middle of this cycle. And I think it is so important for all of us to use our voices. We also do learning forums, so if you have ever participated in one of our webinars, we try to host these webinars for you to be able to meet new experts in the space, but also to ask questions. because I understand not everyone has time carved out to talk about policy or the bigger picture. So that's where we hope to engage you in 1-hour webinars. And so if there are specific topics, we would love to hear how we could provide more of that service. And then lastly, we're a multi-stakeholder convener. If you look around this room, even though some of the groups were a little quiet, it's a unique space. This is one of the very few conferences where you can be in a health plan, you could be a community advocate, you could be a patient, and we welcome everyone. I think that having this diverse audience opens us up to new perspectives and new ideas. So again, I welcome you into this space. I want to start off with this picture. Even though this could be today, this was actually in the mid-1990s, before ITUP started. This was in 1994. I was in high school, and it was the passage of Proposition 187. And this was passed by California voters under Governor Pete Wilson, which many people refer to him as the devil. I don't know, I just heard that. But a lot of Latino and other immigrant communities were scared, and they were terrified to access healthcare, any social services, or even education for their kids. And this was under the threat of public charge, that if you access healthcare, education, social services, you would have to repay every penny that you benefited from before you could move forward with changing your documentation status. And so, I am grounded in this for many reasons. So one, it affected the people that I love and that I cherish. People in my community that were afraid to go out, friends from school that were undocumented. And unfortunately, we're seeing it happen again. And it is really scary and upsetting to think that people have to worry about their immigration status and put that first before their own health and the health of their children and the health of their families. But this is the time we're in. Prop 187 was the first round, and we're seeing it again with the new administration. So yeah, if all of this sounds familiar and feels familiar, it's because it's happening. The Trump administration is back for a second stint at the White House, and threats to our communities are real. Access to coverage and care is threatened once again. Immigrants are being threatened, and many are going into hiding. So funding and services are being weaponized to divide our communities. I'll say that again. They're being weaponized to hurt our communities. And as an organization that believes that all Californians should have access to coverage and care, we must stand together. Everyone in this room, as diverse as we are, it's gonna take all of us to protect the huge advancements we've made in California, especially around insuring the uninsured. Let me share a little bit about how we got here. One of the biggest impactful legislation in the past was Barack Obama passing the Patient Protection and Affordable Care Act. I'd like to say the full name, and this was in 2010, because people often forget about the patient protection part. And I want to remind people, before this, pre-existing conditions were used to not allow people into the healthcare system and coverage. So if you were a victim of domestic violence, you were uninsurable. And, we've made huge progress in that space, but yet, we also supplemented it here in California. I like to say we live in a bubble. I like my bubble. We've made huge advancements working with our state leaders to ensure all Californians have access. So we've saw we expanded Medi-Cal, and then we started with children, 0 to 18. And in 2016, we saw the Trump administration enact repeal and replace and got rid of the individual mandate. But we continued on our journey to make sure everyone could access coverage. In 2020, we saw the state-based insurance mandate and the Medi-Cal expansion for the undocumented folks 19 to 25. And then in 2022, we saw expansion to Medi-Cal for the undocumented ages 50 plus, one of the most vulnerable populations in the state. And lastly, Medi-Cal became available to all ages, all age ranges of the undocumented low-income residents, including 26 to 49-year-olds. So yeah, let's hear it. Yeah. While other states were fighting to not implement these programs, to not expand Medicaid, here in California, we had the right leaders in place that championed this. Last night, we recognized 2 of them at our dinner. And it took all of us to get here. And it's gonna take all of us to protect those wins. And so, one of the things that I get a lot running ITUP, Insure the Uninsured Project, is, isn't everyone already insured? And yes, we have the lowest uninsured rate that we've ever had. But that said, now that people have a card, can they actually access care? And is that care equitable? So that is a pivot that we've made, and we've really thought about this work in 3 sort of areas. So the first is looking at the workforce. When we ask the question at our health equity collaboratives, what positions are short staff, where are the shortages? Everyone says everywhere, everything, at all levels. But we want to be intentional about how do we secure the workforce that we need to meet demand. And we have done so much work on the demand side for health services. We also need to focus on the supply side. Secondly, data. What gets measured gets done. So if we ever want to advance health equity, we need the data to support that work. And this is also really important when we think about population health management strategies, where we're able to target individual communities that are experiencing disparities and having specific interventions to help them. And then lastly, the role of technology. We saw a huge uptake in telehealth during the pandemic, and we recognized, the government recognized, oh, it's a pretty good tool. And so, when we think about even what we're going through today, that people are afraid to go to the clinic, hopefully telehealth can help us resolve some of that issue. It shouldn't be the only tool, but it is one way that people can safely talk to their providers. We're also looking at artificial intelligence and whether it's a friend or foe. I want to be clear that it's an emerging technology. So we've done a few programs, and in the app should be some of our publications around it. But what we're finding so far is that it could be an incredible tool for clinic staff, especially around scribing, which can be ambient scribing, and it cuts down on pajama time for the providers. But also appointment reminders and other things that are administrative and clerical that if we helped staff with those tasks, they could focus on other things, especially the direct care of patients. So that gives you a sense of what we're doing. Over the last year, You know, part of my background, and before I came to ITUP, I was the policy director at Northern California Grantmakers, and I stood up a democracy portfolio for them. And, you know, this was during the pandemic in 2020. I had just gone into remission. I'm a brain cancer survivor, and thank you. Thank you. And that journey, not only was it physical, it was mental, it was spiritual, but it helped me focus on purpose. And, you know, I had been a patient in terms of like getting a physical, but never a patient that had to navigate multiple systems while being sick, moving to a different state to get certain treatment. And, you know, I understand that the opportunities that we have and that we're trying to realize and capitalize on require strong leadership in government, whether that's at the state level, the federal level, city council. I mean, we saw that during COVID, right? We saw the importance of school boards when they were deciding what to do with your children in terms of getting education when everything was shut down. And so we did the series of programs, and we're going to conclude it today with a great panel this morning that looks at this intersection of democracy and health equity. You know, one of the names of the program was what's at risk in the 2024 election. And, you know, we're seeing the outcome, the results of the Trump administration coming back in. So currently, there are threats to new limits on coverage. So they want to lower Medicaid eligibility from 138% federal poverty level to 100% of federal poverty level. That's about $15,000 for one person. I don't know which part of California you could live in with $15,000 a year. And so that would be devastating and knock many millions of people from Medi-Cal. They also want to reduce the FMAP for wealthy states, redistributing funds that would otherwise come to California and send it to states that did not do the expansion. So that is a real threat. What is going to be the impact? What is it going to look like? Well, we're going to see increased uninsured patients. So a loss of Medicaid coverage for many, a financial strain, the loss of Medicaid reimbursements leading to operational challenges for our community health center partners, for our public hospital partners, and also, at the end of the day, reduce access, so longer wait times, cutting services, and job losses in the healthcare sector. And this is the fight. This is what we have to come together to push back, to say, not here, not today. And, you know, I want to, because we're a 501c3, I have to say this, but we greatly appreciate the monetary contribution of our sponsors and funders. Without them, this event wouldn't be possible. And as an independent nonprofit dedicated to improving the health of Californians with an equity perspective, I want to make sure that you understand that ITUP's views are our own. But we hope that they resonate with you as we engage you all of today. So I want to give a shout out to our core support funders, the California Healthcare Foundation, the California Endowment, and the California Wellness Foundation. Please join me in thanking them. We also want to thank our platinum sponsors for today. So we have Kaiser Permanente, as well as the California Healthcare Foundation. Please join me in thanking them. And we want to thank all of our sponsors. As you'll see, there's some new features to the conference this year, including translation. We also have a lactation pod that people can access. And I know Danielle will come up in a bit to share more details on how to engage with these. But we're so grateful to all of our funders, which you can see is a great list. So now I'm going to welcome up Danielle, who is our Director of Strategic Engagement. I can't see anything from here, but yeah, thank you so much. And again, welcome. Don't forget there's water in the back. Bathrooms are out in the hall. And I really encourage you to engage with each other today, to network. Like I said, there's a lot of future generation of public health leaders here that would love to meet you. And if you could take that time and build a relationship or a connection, I think it would be valuable for everyone. So I'm still looking for Danielle. Oh, okay. So I welcome our Director of Strategic Partnerships, Danielle Wright.
Oh, it's okay. Hi, everyone. How are you? Enjoying yourselves? Amazing. Well, this is actually my first conference, and I'm so happy to be here. I'm so sorry, I'm just trying to get my notes here. Where am I? So sorry. I'm just trying to get my notes, but they're not here. Okay, well, we'll just go in. I'm just gonna try my best. I'm gonna wing it. All right, so we first let you, sorry everyone, I don't have my notes. We're just gonna wing it. So we already announced our student partnerships. We are really looking forward to really developing and building our next leaders. So we're so happy to have all of you here. Next slide. So we are hoping that you will be able to maximize your experience as what, during this event, it's not only sharing information and learning about the progress we are making in health equity, but we also want you to maximize your networking experience. It's really important for you to get to know each other, build your relationships, make new friends and peers. So what you'll be able to do on your ITUP app, which is should be downloaded, called Cvent, you can instant message each other, you can follow other attendees, and you can also use the QR code, which is on the back of your badges, to share and exchange information. And so this is essentially kind of like your business card to make it easy and convenient for you. I'm so excited to announce that we are on Instagram. Woo! So we would love for you to capture yourself in all of these incredible moments by using the hashtag ITUP 2025. And we also have, for the first time, a step and repeat outside where you can capture, again, these moments together and have a whole photo op. So also, we hope that you will follow us on our other channels with following Ensure the Uninsured, and we will ensure that we tag your post and put you in our stories. We're also excited to share our new features as well as our sponsors, including Mamava. It's really important that all of our attendees feel comfortable and safe. So all those that are breastfeeding, you have the opportunity to do so in your own, again, safe and quiet environment in room 7. We also have another new feature, which I think is really cool, which is our charging kiosk. So all you have to do is click, and then when you take it out, you have access to multiple chargers, and you can be sure that throughout this event, your phone will be working and functioning and on. We're also excited to share, first of all, who loves free things? I do. I do. I love free things. So today we also have a raffle. And for our raffle, you are able to win an Apple Watch. And so the way that you do that is through the challenges that are on your Cvent app, the ITUP app, and as you follow those challenges, the leader, when there's a leaderboard, will have the opportunity to win the Apple Watch. Also, we have another challenge, a virtual challenge, where you can also win an Amazon gift card. So again, download that app, follow those challenges, and have the opportunity to get an Amazon gift card as well. I want to mention, however, that we are not providing these raffles until the end of the event. So for all those that have to leave early, try to stay as long as you can so that you actually have the chance to win. All right, so for today's agenda, you will be able to access that on the QR code that's in the back of your badge, but you can also access the agenda in your conference app. For all of those that have asked us, where else, or do you have a printed version of the agenda? We don't, we're trying to save paper. However, you can see the agenda throughout the conference where the boards are. Now I am going to bring Crispin back to introduce our opening speakers.
Okay. Let me get my notes back. Give me a second. Yeah, so it is my honor to welcome Secretary Kim Johnson. With over 25 years of leadership in community-based organizations and government, she has been a steadfast advocate for Californians. As a former director of the California Department of Social Services, she led programs serving over 7 million people, driving policies that strengthen families and communities. She was appointed as secretary in 2024, and she continues to champion equity and access across our state. So she is the one that I was talking about when I said we need the right leaders in the spaces. So please join me in welcoming Secretary Kim Johnson.
Good morning. Good morning. Thank you for that. We are in community together, and we're in it together, and it's a pleasure and honor to be with you all. As I was walking into the room today, a lot of familiar faces and people asking about how we're doing, and one of my initial responses was, January was kind of a tough month. Not only, as Crispin noted, the fires that were devastating to Los Angeles, and for those of you who were impacted or know someone who was, heart with you in the recovery. I spent over half of January in Los Angeles hearing directly from survivors, visiting the federally qualified health clinic that unfortunately was burned down, meeting with the doctor who was providing that telehealth service at the time before evacuating our skilled nursing facilities, adult and senior care settings, the shelters that have been stood up for evacuees. Really, truly devastating, but I am also taking those opportunities to learn what we can do better, and there is progress we can make in response, but also demonstrating our full commitment. As you know, the governor has been there most of January and beyond in recovery. So a long-standing effort that will become, but we are together with Los Angeles in those efforts. And also the federal transition that has been mentioned, right? Numerous executive orders, funding freeze. Thank you, Attorney General Rob Bonta, for unfreezing us. And so again, as we recognize the moments that we're in, I want to just ask you to turn to your neighbors on your left and your right and say, we are in it together. That is going to make the difference, all of the difference in the world on how we work through these challenging times, and I do believe that we are absolutely stronger when we're in it together. I am a proud Born and raised California native, and would like to be no other place in this moment but here, and appreciative again of the partnership that we have. It's an honor to serve in this new leadership capacity, and I have the great privilege in that capacity of sharing so much of what has been accomplished together. And so as I share some of your work, your efforts, and what has been accomplished to date related to healthcare access and affordability and more, I want you to all think about the strategies that yielded this success. Because again, as we're in it together, we have to be clear about what strategies we use to protect our progress moving forward. So as was mentioned, Covered California, bringing healthcare equity to Californians, closing those gaps and disparities, including reaching the remaining uninsured across the state. There's been, in this last session, new enrollment increases in every region of the state and across all demographic groups. As you heard and should know, since Covered California was implemented, the uninsured rate has dropped from 17.5% to 6.4%, the largest drop in the uninsured rate across the nation. And as of last Wednesday, a little bit before the open enrollment period closed, Covered California surpassed 1.9 million enrollees, bolstering its record high enrollment before the deadline. So we have another 1.6 million Californians who have just renewed their health insurance plans, a 10% jump over the same date last year. And of course, we're offering additional opportunities for residents in Los Angeles and Ventura counties to have some extension through March. We also have, for the very first time, the ability for those who have DACA status to enroll. And so these are tremendous, tremendous wins. And again, more to do. There's still a gap, and so we always want to make sure that there's focus in that space, but want to acknowledge the work to date. And of course, as we also look at health access and affordability and coverage, we're always thinking about our lens of who we are serving, how they are doing, who we are not serving, and why. And as you heard, we implemented last year a new law in California to allow all adults residing in California, ages 26 to 49, to qualify for that full scope Medi-Cal. As a result, we expect to be serving 14.5 million Californians, or approximately a third of our population, in Medi-Cal next year. We are making progress. As some of you know, and as it was stated, I have spent my career on working to address social determinants of health in the space. And as you know, one of our major cornerstone initiatives within the Newsom administration is California Advancing and Innovating Medi-Cal, or CalAIM. This is looking again in a person-centered way. How are we intentional about getting access to health care that goes beyond the doctor's office to comprehensively address physical and mental health needs of all of those that we're serving? Enhanced care management and community supports are foundational to this transformation. We're breaking down those traditional walls of healthcare. We're introducing a better way to coordinate care, providing members with higher levels of need with in-person care management where they live. Focus on those who are unsheltered or unhoused neighbors at risk for hospitalization, those with serious mental health conditions, children and youth in those same categories, youth in foster care, pregnant, postpartum individuals, and more. We are prioritizing those that need us most in this space, and want to again say that we are making progress. So if you look at just the enhanced care management component of this transformation, since the launch of this effort in 2022, where 78,000 individuals were receiving that management. In last year, it was 244,000 individuals receiving that support. Also, when we look at community supports, which was 14,000 in 2022, we see nearly 240,000 people receiving those supports. Still more work to be done, but again, the progress is real. That actually equates to or translates to people's lives and their access to a much more comprehensive set of services. Again, I'm going to continue to repeat it. We're always looking at who we are serving, how they are doing with those services, who we are not, and why. And with that same lens came a real focus on the Justice Involved initiative that I know you'll be talking more about this today. And on January of 2023, California became the first state in the nation approved to offer a targeted set of Medicaid services to youth and eligible adults in state prisons, county jails, and youth correctional facilities for up to 90 days prior to their release. Really looking at increasing coverage, continuity of coverage, service uptake, access to services that actually support those transitions and provide continuity of care, providing behavioral health interventions, which I'll speak to more in a moment. So again, just another example, there are many, of how we're being focused in our efforts of who we're serving and thinking through the lens of equity. I also want to say tremendous, tremendous work done in the workforce space in health. Everything from new community health workers, promotoras, doulas, again, trying to think through who Californians are, what do they need, how do we ensure that the diversity of our wonderful state and the needs of those across it are met. And as you've heard, as a cornerstone of the governor's administration, behavioral health transformation has also been a key piece to this. We are modernizing our behavioral health system to provide services to anybody, anywhere, anytime. The narrative is changing. I can tell you that when I was in Los Angeles County last month, everywhere I went, doesn't matter at the adults, older adults in the senior center or at the children's camps or at the evacuation shelters or disaster recovery centers, behavioral health was present and really looking at the continuum of needs of those who are impacted by the trauma that they had just experienced. We all need help sometimes. Some of us need more, some of us need less, no stigma, no judgment. And again, to know that that is being accessed, especially with our children and youth, so great to see that that stigma is changing, again, with the tremendous investments and transformations that we've made. We recognize here again in workforce the shortages not only that California experiences, but is experienced across the nation. So we have been very intentional about the workforce efforts. We have the Behavioral Health Community-Based Organized Network of Equitable Care and Treatment, also known as BH Connect, that was just recently approved. That's going to provide $1.9 billion in short and long-term investments in the workforce for the next 4 years. That's tremendous. We are looking, yes, please. We're also, again, focused on those that have significant behavioral health needs and to really make sure we're addressing the gaps. But again, that focus and intention on building a large, more diverse and well-trained workforce continues with all kinds of supports to make that realized and implemented across the state. We also, again, always think about populations, and so we're mindful of the gaps that exist, particularly for older adults. You all might have also been part of our master plan for aging and really being thoughtful, again, how some of these behavioral health supports are going to support that particular community. Everything we do, whether it's healthcare access and affordability, access to behavioral health services, transforming the system, we have to pair health and behavioral health gains with how we do business, the integration of service with how we do business. We're obviously heading out into our implementation of Proposition 1, which includes the Behavioral Health Services Act, and again, focused on those with the greatest needs and substance use disorders, prevention, early intervention, treatment, and housing. You're gonna hear me say and housing, and housing, and housing in everything we do. Expanding housing access through behavioral health continuum infrastructure program for older adults in the long-term care continuum with community care expansion. We think about how families experience poverty in California in the CalWorks program, have access to voluntary home visiting, which gets them connected to the various health, immigration remedies, all other kinds of supports. We're innovating when it relates to economic mobility and supports with guaranteed income pilots. And again, we're thoughtful about how the services are delivered by various populations in focus. Domestic violence survivors, unsheltered neighbors, those without an immigration legal remedy, older adults, those with intellectual and developmental differences, and more. Those are just some of the ways we've achieved wellness with the integration of our efforts. We must continue to be intentional. I know many of you always raise, but saying, what about, right? Because again, we haven't fully realized our objectives, but we are making progress. So continue to hold us accountable in that space and be intentional, and we know there's much more work to do. In closing, I want to address the unsettling uncertainty that many of us feel moving forward, particularly with the federal transition. Health is a universal issue. We can never forget that COVID really gave us a different kind of sense of how we're connected in community. The health of my grandmother living at home actually depends on me interacting with the clerk at the grocery store. We are tied together. We have to recognize that and realize that. And so health should continue to be a focus that is universal, and we will make it so at all levels. And we'll work with the federal administration in that vein wherever we can. We're going to accomplish it by working together, being strategic. And again, I want to thank and be grateful for the partnership we have with the legislature, leaders like Assemblymember Mia Bonta, the leadership and partnership of the Attorney General, and the strategy that we take on that front. Thank you to those in the room who have had lived experience and been willing to share your stories that really help make the impact of these investments and priorities real. Thank you to all of those who have been advocating for and providing these critical services in community. The actions are going to be critical. Being strategic is going to be critical. Being together and understanding what is real and what is not is going to be critical. I again say a special shout out to everyone in the room who's an attorney. I know we didn't do that in the beginning, but I appreciate the attorneys so much always. And I think in this moment, we got to give them an extra love. So again, please take the lessons learned through our experiences of the successes and gains we've made in wellness in California into how we take care of each other. The how matters in our responsibility and our mission to support Californians across this wonderful state. Thank you for the opportunity to be with you this morning.
Let's give Secretary Johnson another round of applause. We are lucky to have you in this great state. Our next speaker will provide us with the latest federal updates. These updates will help us understand the broader political and policy environment affecting California and its residents. As federal policies continue to shape our work, it's important for us to stay ahead of the changes and remain proactive in advocating for health equity. Please join me in welcoming Attorney General Rob Bonta. He was sworn in as the state's 34th Attorney General. He is the first Filipino American to hold this role and a lifelong champion for justice. From fighting for racial, economic, and environmental equity to holding powerful interests accountable, Attorney General Bonta has dedicated his career to protecting Californians. So let's give him a warm welcome, Attorney General Rob Bonta.
Good morning, everyone. How are you today? Wonderful to be with you, and thank you, Crispine, for the very kind and generous introduction. You're about to get a big dose of the Bontas right now, so apologize in advance for my contribution to that. Congratulations on Assemblymember Mia Bonta's contribution to that. You'll hear from her in a second. I was the chair of the Health Committee in the Assembly when I was in the Assembly, honored to be there, and Chair Bonta, Mia Bonta, has significantly upgraded the leadership in that committee since I was there. First of all, I just want to say thank you. It's important that we come together at times like this, where there are dark clouds coming from the federal administration, and find each other. Folks that are committed to making sure that healthcare is a human right, that everyone has true access to high quality, affordable healthcare. That was my goal when I was in the Assembly. That continues to be my goal as Attorney General. And when we have, and this is a euphemism, an evolving federal landscape, like we're having right now. It's critical that we convene and discuss best strategies to provide critical health services to all, to meet that goal that we all share together. And as AG, I'm using every tool I have to defend, to protect, and strengthen access to high-quality, equitable health care for all patients. And now, as we face another Trump administration, we're preparing for more challenges to accessible health care. Unfortunately, it's time to double down and recommit for the fight ahead. And rest assured that we are going to be watching the federal government's health care administrative actions very carefully. And unfortunately, we're already seeing a few disturbing actions and patterns. The Trump administration is trying to take money out of healthcare programs like Medicaid in order to fund priorities of theirs, like tax cuts and immigration enforcement. They're targeting politically vulnerable patient populations like the LGBTQ+ community or undocumented immigrants. They're attempting to roll back federal civil rights rules that protect access to reproductive health care. But when the Trump administration takes executive actions that are illegal and threatens harm to California and its residents, we'll hold them to account. We will take them to court when they violate the law, when they violate rights and freedoms. And it's important, we will keep doors of communication and partnership open wide. It's important that we work together, collaborate with each other, hear from each other. We particularly appreciate information sharing from stakeholders, including everyone here today. What's happening on the ground? What are you seeing? What are the threats? What are the risks? How can we help? We're at our best when we're working together, collaborating, working with like-minded, shared mission entities and individuals like all of you. Every day it seems something new is thrown at us. Take the spending freeze last week that created a lot of chaos and caused the portal to access Medicaid funding to shut down for a while. And this is something that we should sort of settle in to expect going forward. The confusion and the chaos is the goal. Flooding the zone is the strategy. And we're going to see more of what we've seen over the past 2 weeks. I know the past 2 weeks seems like 2 years. There's been so much activity, a flurry, a frenzy, a blitz of executive orders, seemingly every day, including over the weekend. And we're ready for all of it. And I know you are too, but we need to be prepared for the volume. They're trying to have that show of force and overwhelm us with their activity and their actions. In response to the attempt to freeze federal funding, nearly $3 trillion of critical, essential federal funding to things like the CHIP program and Medicaid and food programs and housing programs, early childhood education, college funding. In response to that, we filed a multi-state lawsuit immediately. We, being Democratic attorneys general from across the nation, and we obtained a temporary restraining order, halting the freeze, freezing the freeze, pausing the pause on that vital federal assistance so that the money will continue to flow. Protecting all Californian residents' rights to access needed health care and protecting the state's decision to expand its state-funded Medi-Cal program to all low-income residents, regardless of immigration status, is a top priority. Our entire state is better off when everyone has access to affordable and accessible health care. At DOJ, we believe that public health care facilities should be available to all without fear of civil immigration enforcement. That's why we're encouraging non-public facilities to be prepared with updated policies and procedures if federal immigration officials attempt to use healthcare facilities or private healthcare data to support an inhumane mass deportation agenda. We'll vigorously defend against any new federal policies that interfere with state laws and state-funded programs or that overstep the federal government's authority with respect to federally funded Medicaid. Regardless of who's in the White House or who controls Congress in California, we're going to keep moving forward. We're going to continue on our path of progress. California DOJ played a key role during the first Trump administration, Trump 1.0, to protect Californians' health care rights and access. We were able to be successful in preventing harmful actions, our office stepped in to defend the constitutionality of the Affordable Care Act when the United States DOJ refused to do so, ultimately convincing the U.S. Supreme Court to uphold the ACA. We defended state laws like our sanctuary state law and vaccine mandates. We obtained injunctions that put temporary or permanent stops on federal rules for violating the Administrative Procedures Act, like public charge, a cruel policy designed to force immigrant families to forego public programs like health care out of fear that it would jeopardize their immigration status, like a gag rule on Title X reproductive health care providers, and a technical change to Medicaid regulations that would have prohibited California from following state laws that allowed deductions of bargained for employee benefits and union dues from IHSS provider paychecks. So we're ready to do all that again if needed, plus whatever new actions the second Trump administration decides to throw our way. I'll continue to stand with you on the front lines of the fight for equitable health care. When it comes to health care, we face many challenges. I've just laid out quite a few, but I remain optimistic, and I hope you do too, because we have the same shared mission: ensuring affordable, accessible, and equitable health care for all. And I know that there's nothing we can't do when we do it together. This is a time of concern and anxiety for sure, but I find hope, optimism, strength in all of you and all of us. I've talked about California a lot over the last few weeks, and I've always told myself not to cuss, so I won't. But we are frickin' California. We are the largest state in the nation. We are the largest state in the nation. We're the 5th largest economy in the world. We're the tentpole of the American economy. We're the most diverse state in the nation. We have led to the phrase, as California goes, so goes the nation. So as we face these challenges across this great country, people are looking west to us, to California, to see what we do. How we fight, how we push back, how we continue to be committed to our values. So I want to thank you for all you have done, all you're doing, all I know you will do in the weeks, months, and years ahead. Thank you for your advocacy, your commitment to achieving health equity. I look forward to our continued partnership and ongoing work in the years ahead. Thank you.
Wow. Let's give it up to Attorney General Bonta once more. Yeah, the entire time I was thinking, wow, that's a power couple. I just want to be a fly on the wall during your dinners. Like what, I don't even know what those conversations would be like. Next, we're honored to welcome a representative from the California State Legislature, who will provide us with the latest updates on the legislative landscape. As health policy evolves, it's crucial that we stay informed about legislative changes that can impact healthcare coverage, access, and equity. It is my honor to introduce a true trailblazer in health policy and social justice, Assemblymember Mia Bonta. As chair of the Assembly Health Committee, she has been a driving force in expanding Medi-Cal, improving, give me a second, sorry. Yeah, she has been a trailblazer in helping us improve equity for all Californians, and it is my honor to welcome her up. Welcome, Assemblymember Mia Bonta. Thank you, yes, thank you.
Thank you so much. I think Rob and I took our vow seriously when we said we were going to be partners in life and partners in service. I didn't know that we were going to treat it so literally in this moment, but Thank you for the opportunity. I am Assemblymember Mia Bonta. I get to proudly represent the District 18 in the East Bay, Oakland, Alameda, and Emeryville. I see many, many of our health warriors here in the audience. Jane Garcia, I see you. And I have the distinct honor in this moment of chairing the Assembly Health Committee. I want to begin by thanking Insure the Uninsured Project for gathering with us today on your 29th annual conference. My goodness, 29 years. And congratulations on advocacy, groundbreaking advocacy, and addressing the barriers to accessing health care and a push for equity and quality in care. I'd also like to thank Safe Credit Union. We cannot ever underestimate the power of our workers in making sure that we have a just community. And so to the staff here, thank you for making sure that this event is possible. When I talk about in my district, I often talk about the extremes we have and we see, especially regarding health. My district is home to many premier health companies, Kaiser, Sutter Health, UCF Benioff Children's Hospital, along with multiple federally qualified health centers like La Clinica and Asian Health Services and Native American Health Services in the West Oakland Project. However, my district is home to extreme amounts of need. Too many families in my community cannot afford to have health insurance, and for many, the health insurance they do have, they cannot afford. As a mother, a legislator, a partner, a healthcare chair, and a person, this devastates me. We will not be able to create the healthiest California that we need when, for so many, accessing quality care seems out of reach. That's why I'm grateful to be able to have your advocacy and honored you have taken the time to gather to fight for change. But we know nothing changes if nothing changes. I can tell you, though, that change is starting right here in this room with the work that you all represent every single day on the front lines. And I know that these are incredibly scary times, epically, generationally scary times. I've been closely monitoring, as you all have been, the campaign promises, which have actually turned now into campaign threats of our president, who has made the health space his primary field of interest, some of which you have already started to see in the works. Within hours of taking office, President Trump rescinded Biden administration's executive orders that lowered drug costs and expanded Medicaid eligibility. That was a gut punch. We know that if Trump follows through on his promises to end the Enhanced Affordable Care Act subsidies, all Californians in the individual market would see their insurance premiums go up. Over 2 million people would pay anywhere between $200 to $1,000 more per year as a result of these subsidies, ending with 69,000 additional Californians expected to potentially become completely uninsured. And as we saw last month, his erratic governance by tweet and executive order could have dramatic, even if it's unintended, impacts on Medicare and Medi-Cal. California and the legislature have a responsibility to protect our constituents and well-being. And if you saw our Assembly Speaker yesterday, you saw the fire, you saw the intentionality, and you saw the commitment that our Assembly has and the legislature has to ensuring that we will stand in the breach in this moment. And I'm very proud that as a part of our legislative package, I introduced AB 298 towards those efforts, which will prohibit out-of-care health costs for children's health care. Right now, even $50 copay may be the reason that families decide not to seek care. So by eliminating these costs, we can ensure that all children in the state get the care that they need. This year, as legislator and chair of the Assembly Health Committee, I will remain committed to authoring and supporting legislation to ensure Californians have access to health care they can afford. Let's pay attention to the essential health benefits benchmarking that we will do, both on the Senate side and on the Assembly side, where we are seeking to ensure that critical services get included in our plans. Hearing aids, durable medical equipment, IVF, the things that we have for far too long kept our community members, our most vulnerable community members, from having. Now, I know I'm talking to a room full of frontliners. I am not unaware of the daily challenges that you face in making sure to bring equitable, accessible health care to every single Californian. And I'll say this, and I've said it in many rooms. I know you are tired. I know you are weary. And I know that many of you hold the fear of your communities close right now. And I have to tell you, every single one of us are going to have to dig deeper. When we have the possibility of having 15 million Californians feeling like they cannot go get health care. When we have the destruction, the imminent destruction of the Department of Education, where so many of our children get care through our schools. It is beyond a moment that any of us can really, truly comprehend. But I know that the California State Legislature, the Assembly in particular, this particular health chair, Secretary Johnson, the Bantas, together, will have your back. And with that, we will endure. Thank you.
Wow. I feel like an underachiever. That was amazing. Next, we're gonna call up our opening plenary for this morning. Again, this next presentation, this panel, From Ballots to Health, Understanding the Political Determinants of Health in California, is part of that work that I mentioned earlier around exercising our civic processes to empower, bring our leaders up, and support them once they are elected. I think that the speakers we've heard this morning represent what we're all trying to do, and they're hitting it at the statewide level. And so I'm gonna welcome up Chet Hewitt, who will be our moderator, from the president and CEO of the Sierra Health Foundation, Louise McCarthy, president and CEO of the Community Clinic Association of Los Angeles County, and lastly, Manjusa Kulkarni, I believe, and she is the executive director at AAPI Equity Alliance. So welcome, and yeah, we're looking forward to this conversation. Thank you.
Good morning. I think I could hold that a little bit away from myself. I'm known to have a big voice, and so I'll try to make this as comfortable as possible. Let me start by saying that when you walk into this room this morning with all that's going on, I think as the Assemblywoman said, our hearts are heavy. But after hearing Secretary Johnson, AG Bonta, and Assemblywoman Bonta, I feel a little lighter. It is really important and great to know that California leadership, on the administrative side, on the political side, and political legal representation, is really on the side of Californians. That is not true in all states. And so we have a very special opportunity here to push back against what you all know to be some pretty malicious policy proposals as relates to health in America. As introduced, my name is Chet Hewitt. I'm the president and CEO of the Sierra Health Foundation and the founding CEO of the center at Sierra Health, often referred to as the Center for Health Program Management. Both institutions have been focused on the social determinants of health for the past 15 years. And our goal is to really push back or to help advance, let me try to use positive language here, right? To help advance racial, economic, and physical health equity across the great state of California. And we have used both our grant making, contracting, and our power building work to make that actually happen. This morning, I'm joined by two individuals, two extraordinary leaders in California who are doing very similar work in their own way. Manju Kulkarni, who's Executive Director of the AAPI Equity Alliance and co-founder of Stop the Hate, Stop AAPI Hate, thank you for the correction, and Louise McCarthy, who is the President and CEO of the Community Clinic Association of Los Angeles, the largest community clinic association in the state of California. The title of this panel is the Political Determinants of Health. And I'd like to take a minute to kind of frame it. And I'm going to look at my notes more than I typically do because I've really been interested in this notion of the political determinants of health and its impact on our work around the social determinants of health, probably for the past 8 or 9 years. And there is a book that I would implore you all to take a look at, written by Daniel Dawes, called The Political Determinants of Health. No wonder. And in that book, there is a foreword written by one of my heroes in public health, Dr. David Williams. In his foreword, he says that while it is vital that we understand and work to address the social determinants of health, that Daniel Dawes makes a case for why we must also be prepared to address the political determinants of health. And these are defined as civic engagement or voting, public or government investment, value, and the administration of power, policy. What he describes as what is often the causes of disparities. And I think over the past several weeks, we have seen just how true that can actually be. Now, to kick off this conversation, I'm going to go to Louise first, and I'm going to ask you to say a little bit more about yourself. I've done a brief personal introduction, some more about your organization, and if you could kind of, from a perspective not shared yet, talk about the political moment we're actually in.
Well, thank you and good morning. And when you say moment, you're talking about this 1 minute of time before any new announcements come out, right? So as mentioned, so Louise McCarthy, the Community Clinic Association of LA County, we are the coalition of all of the community clinics and health centers in Los Angeles. So that's Antelope Valley down to Long Beach, Venice into the San Gabriel Valley. There's 118 organizations that serve over 2 million patients each year. 1 in 5 Angelenos is served by a community health center. Community health centers in LA serve 1 in 3 of LA's Medi-Cal beneficiaries. So they're definitely a backbone of the safety net for LA and Medi-Cal and the Medi-Cal system. Around 85,000 of the folks that are served in the community health centers, in the most recent data we have, were experiencing homelessness. 85,000. And so as we think about, the community health centers and, how we support them, we we have the honor to be able to support them with advocacy at the county, state, and federal level, training and technical assistance. But additionally, we're the disaster resource center for the community health centers. So the last several years have found us doing things that were unfortunately new to us. Whether that was vaccine distribution and speaking up for equity in distribution with vaccines, to more recently working with folks like Direct Relief and others to make sure that the health centers impacted by the fires were getting access to the resources that they need. So, and I come to this work, and I'll just say sort of my why, and we think about the political determinants of health. My mom was buried on the 6th of January, and her dad, she grew up in a little rural county, Beetle County, South Dakota, and they went out to a farm that had no services, nothing, and he didn't know how to farm either, so this was not a smart move on his part, but well, some bright ideas. But he went to the Mennonite colony, and he went to the Russian colonies near them, and got them to register to vote. And then he ran for county supervisor so that they could get resources and services out to their farms. And so my mom's father kind of set in motion what would later become something that's just ingrained in our family, is you vote and you knock on doors to get people organized. And now, working with the health centers are engaged in My Vote, My Health, making sure that that patients know that they should get a prescription to vote because it's going to impact their health. So we think about that why. The other why for me in this work is that Medi-Cal saved my life. In 1996, I was in the hospital in Fairfield, California, with a $22,000 bill staring me in the face. In emergency Medi-Cal, I narrowly qualified in that moment in time, pre-ACA, and that took the bill away. Without that, I wouldn't be where I am. I wouldn't be a homeowner. I wouldn't be a taxpayer at the level that I pay, an employer, or anything like that. So healthcare is transformative in our lives. Voting and civic engagement is transformative in our lives. And really thinking about, when you walk into a health center, there's a scope of practice. The doctors do the doctoring, the nurses do the nursing, the medical assistants do the assisting, coders do the coding. Similar for all of us in the room. There's students, there's think tank folks, there's funders, you name it, lobbyists. We all need to work to the top of our scope right now in this moment to support folks like the Attorney General, who, thanks to him, yesterday I got notice of a restraining order against the federal government so that our funding, which we got notice of being cut last week, it's still coming in. And that's amidst everything else that's gone on as we think about started with the fires on the 7th. The following week, even under the prior administration, we had massive immigration enforcements happening in the Central Valley. And then the 20th came around and we had inauguration, followed by this whack-a-mole moment where it's chaos by design. And we talked earlier, not strategy. I don't know that it's strategic, but it's by design. And so as we think about this moment, it's about making sure that we don't get seasick, we don't get overwhelmed by the onslaught, and we try to zoom out and have a wide lens and look at what can we do in our moment, what's within our capability to influence, focus on that, and try to reduce the noise, because that's the thing, that those distractions are what's gonna really wear us out before even the first 100 days are up.
Thank you. Manju, same set of questions for you.
Great.
You can clap. That
Yeah.
Please.
Good morning, everyone. Again, my name is Manju Kulkarni, and I'm with AAPI Equity Alliance and Stop AAPI Hate. First, I want to just thank ITUP for hosting this amazing gathering, and Crispin and his team, who've been fabulous. I also want to express my deep, deep sympathies for my fellow Angelenos. So many of my friends and colleagues have been directly impacted by the fires. They've lost their homes. Many more had to evacuate. And I'm hopeful that much like after COVID, it gives us an opportunity to sort of really rethink some of our policy decisions, especially around housing, around environmental justice, because these are issues that are going to be with us for a long time. In terms of myself, I'm an immigrant. I was born in India in 1969, came with my parents as a result of the Immigration Act of 1965, which is celebrating its 70th anniversary this year. And you know, for folks who don't know, the Immigration Act of 1965 was actually really, really important for a few reasons. One is because for about 50 years, it was illegal for people like me to come to the United States. Folks don't know about the Asiatic Barred Zone Act of 1917, which prevented South Asians, East Asians, Southeast Asians from coming to the US. It was a total bar. And there was some loosening of the restrictions by the 50s. And then in the 1960s, civil rights leaders, after they got passage of the Civil Rights Act and the Voting Rights Act, they said, you know what? Our immigration acts are pretty racist too, because they only allow immigrants from Europe. And so with that, it opened up some pathways, not all of them, but some really important ones. My parents were able to come over because of the professional visas that were opened up to doctors, scientists, and engineers. There was also the beginning of refugee and asylee classifications, which of course we're seeing an undoing of now, and family reunification. And all of those help to create what really is the modern Asian American community in the United States. And so I'll share just very quickly a personal story. So after my parents and I came, we were in Kansas City for a bit, and then we moved to Montgomery, Alabama. It seemed like there was an opening post-civil rights movement, but in 1980, when my mom went to apply for a job as a physician in a family practice group, there was a panel of white male physicians that had really only one question for her, which was, why do you foreigners come to the United States and take all of our jobs? 1980, so in most of our lifetimes. She and my father hired an attorney who was on the board of the Southern Poverty Law Center. And the suit actually, which was a class action because University of Alabama at Birmingham had never hired a non-white immigrant doctor, right, for their residency programs, again, by 1980. And so within 6 months, that class action lawsuit was settled, and it changed policies in the state of Alabama. And these were just my parents who fought injustice. Lawyers were not their best friends. You know, this was the time of tort reform across the country. But I share that, you know, I really appreciate what Secretary Johnson said, because lawyers are important. We know that Attorney General Bonta is there for us. And I want to just shout out so many of the lawyers that I worked with in my first position at the National Health Law Program, health lawyers who are there day in and day out fighting for our programs like Medi-Cal. Back in the day, it was also Healthy Families. We did a 160-page analysis of the ACA right after it came out, and had the Health Consumer Center. So fast forward, in 2017, I went to AAPI Equity Alliance, and we're a coalition of 50 community-based organizations that together serve and represent the 1.6 million AAPIs in Los Angeles County. So we are 16% of LA. 1 in 6 Angelenos is Asian American or Pacific Islander. We do work in a variety of areas: environmental justice, housing, economic development, and most importantly, health and mental health. And we ran a COVID-19 task force and actually got out outreach, PPP, vaccine clinics to those million-plus people in LA. I just want to mention one other thing really quickly, which is that today actually is the 5-year anniversary of the first incident that we saw in LA of COVID-19 related hate against our communities. A 12-year-old boy in Los Angeles at a LA Unified school went to school like normal. This was before a single confirmed case of COVID-19 in Southern California. And on the schoolyard during recess, another kid came up to him and said, "You're a COVID carrier, go back to China." And just reflexively, he answered, because he's not Chinese, he said, "I'm not Chinese." And then he was punched in the face and head 20 times by this other child. And I share that because it was a reminder really for our community that racism spread more virulently than the virus itself, and that our community would be targeted and scapegoated. And so I got together with my two co-founders, Cynthia Che and Russell Jung, and we co-founded Stop AAPI Hate. And within just a few weeks, we got several hundred, then 1,000 incident reports, and it's now over 12,000 from just individuals across the country who said they too have experienced hate. It's not even just about COVID anymore. It's about things that individuals hear from our president, from the administration, programs that scapegoat our community. And so out of that came the AAPI equity budget in California, $165 million, a historic first. And I'm really proud to say that we, along with Sierra Health Foundation, serve as one of the 5 regional leads for this work. We have 180 organizations in California fighting against hate, preventing future hate incidents. And part of it, and this is why it's important to health, this is a health issue. This is a mental health issue. This is a public health issue. And so we want to remind folks that in order to have true health, we have to stop hate.
Thank you. Thank you. And thank you for sharing, parts of your own personal journeys in this respect as well, because embedded in your stories are the political determinants of health. Policy, who gets hired, who gets opportunity, right? Civic engagement, the power of a constituency to shape who gets to be in power. And then, of course, investment, because the policy, which is in its core a value system, a value statement, gets to shape the things that we invest in. Right? We all say that there has been an enormous amount of chaos over the past 2 weeks, which threatens health status of Californians and folks across the nation in many, many ways, beyond the clinical environment. You deport folks whose documentation status is in question, who we once described as essential workers during the pandemic, because they picked our food and made sure that we had groceries on shelves. And we know that increase in prices, which are likely to follow, make it less likely that folks will get the types of nutrition that they will actually need. So there's clearly a connection around these particular issues. So my next question for you is, in this particular time, when we really need to make sure that we have support for our elected and appointed leaders, what is the role of folks in this room? How can we organize ourselves to influence the political determinants of health? And more specifically, since there are so many causes under attack, how do we make sure that the tent is big enough for all of our issues to be included? And Manju, I'm going to go to you first for a response.
Sure, thank you. So I'm going to posit a few probably controversial things, and I'll say some of that is because I spent much of the last 24 hours watching MSNBC and CNN. I watched it, so you don't have to. But I actually think what we are seeing right now is a quiet coup. We use the word coup about other countries. We never use it about ourselves, right? Because we're exceptional. American exceptionalism. This would never happen here. It is absolutely happening here. What we are seeing is authoritarianism in action. We are seeing Stalin-esque purges of employees at USAID, whole agencies, as was said earlier, the Department of Education. And we are seeing actually a private citizen who has access right now to the US Treasury. That means every single person's in this room documents, their tax records, their social security numbers. Yesterday, President Trump talked about a secret wealth fund. There are 19 to 25-year-olds who are recoding the Treasury Department database to do what? To gather our information, to move funds, to defund whole parts of our government. The media, right? The social media right now, much of which we use, Instagram, X, are owned by the oligarchs. They are not here for us, nor were they ever. They are also using our information. They have changed elections, right? We should be very clear about that. Probably the 2016 election was because of decisions made by Meta. Probably the 2024 election was determined by X. The legacy media is sane-washing much of what happens right now, not telling us the truth about it. And they themselves, right? My own newspaper, the owner wouldn't allow for an endorsement because he didn't support it. He has made editorial decisions about the LA Times that are not, have no journalistic integrity. And we have an abdication by our Congress. So just before I left my hotel room, there was a committee vote for Robert F. Kennedy. He will be our next Health and Human Services secretary. And I have to say too that the opposition party is mostly nowhere to be seen, right? They're voting up many of these nominees, and I'm not sure they have a strategy. If you want to look for a strategy, look at Chuck Schumer's Twitter account, and you'll see it's pretty pathetic. So, I'll say that I'll posit a little different theory, which is, yes, there's a lot to distract, but it actually is a coherent theory. It was in Project 2025. They are doing now much of what they told us they would do. Right? They told us. We were warned. And I know it's a lot for every one of us. I actually didn't watch the news till yesterday since November. I tried not to. I still read my New York Times. I read Blue Sky, which is now my favorite. But so one is and Adam Serwer said years ago, cruelty is the point. In fact, just before I left, I saw that El Salvador has built camps and prisons and said it will accept U.S. citizens also, in addition to undocumented folks from any country. So they don't need permission from other countries anymore. So I share all this with you because I am still optimistic. I am, because I know us as Americans. But we need to be realistic about what is happening, and we need to be aware of it. And one thing we need to do as individuals is maintain that awareness. As hard as it is, yes, you know, if you need to bake or knit or spend time with your family and go to Disneyland, do all of those things. But still, we need you to watch the news. It was, and I'm gonna quote actually another panel that Chet moderated at Cal Nonprofits. Jody Hicks from Planned Parenthood said something which is one of the smartest things I've heard in the last 6 months about the election. Misinformation is free. Good, reliable information is behind a paywall. And that is what happened. And that is what continues to happen. And so if we only go for free information, we are going to be deluded, and we are going to lose what democracy we have.
Now, you said a lot in there. Thank you for that response. And you could applaud, because there was a lot of honesty. And I think inherent in her comments is the fact, and this is one of those political determinants that we got to be focused on, that honesty can get you in trouble. Honesty can put you on a list. Honesty may get you deported or tagged as some criminal. And in America, where you have a right to have an opinion of your own, even if it's not popular, that political determinant, as relates to health and prosperity and the grand idea of America, is incredibly challenging as one of those meta issues that we need to focus on. I want to get this opportunity to have some audience questions, so I'm going to ask us to be a little more rapid fire in our response. I want to give you an opportunity to respond, and I also want you to talk a little bit more about what we, as a collective, should be thinking about doing to push back against some of the things that we're seeing.
Thank you for that, and I'm in love with you. Okay, so just fangirling over here. She's amazing, and I agree wholeheartedly. We're seeing that they gave us the plan, and now they're executing it. So it's, you know, people in this room. You know, I think about, you know, us from LA. You know, we have our echo chamber. There is not one red Congress member from LA, but you know, California is purple. And so as we think about, you know, sometimes what's best for us might be to stand back and let our colleagues in this, who's from the Central Valley here? Can I hear some Central Valley love? Anybody? Okay, all right, we love you, we love you. I know Inland Empire, I saw some folks from Chaser here earlier. For us to step back and to let the folks who do have red Congress members take the voice, speak up, because the Republican Party is not a monolith, right? There's already cracks, and that's what we have to, you know, that's where the light comes in. So thinking about where do we get in, where you fit in, and where you're gonna make the most difference, right? So making sure we elevate the voices that are gonna have the best impact, that we put energy towards that. We get out of our own way, because I think, you know, I went to so many marches 8 years ago. I had a march bag. Now I have a go bag for fires, but I also have I had a march bag in my car for whatever march was happening that week. Something's different than 8 years ago. I'm older, and I need to think about my energy and how I preserve that. So I think it's also very important for how we take care of ourselves, because it requires a great amount of discomfort to do this work. We have to be able to have some courageous conversations that and sit in discomfort with people, and be willing to speak truth to power, and knowing that it might put us at risk, and think through how do we do that and take care of ourselves so that as this progresses, we get stronger and not weaker.
Thank you. You know, yes, thank you. I'm married, but I'm in love with them both, so. You know, one of the things that's really difficult about the time, and Louise, you mentioned this, is the burdens that we all carry in this particular work. And one can argue that those who are most at risk are probably feeling it even more so than we are. And I just want to really acknowledge that. But I have, over the course of my career, come to understand that I do not try to compare folks' discomfort. Pain, your pain, is pain. And we should try to figure out how to alleviate that in any way that we possibly can. But as we think about the populations who are most at risk, those who will find it hardest to find their voice in the way that you're calling us to, because the implications for doing so may not be a list. It may be a flight to El Salvador or someplace else. What do we need to be thinking about and doing in support of our political and administrative leadership to push back on that reality so that those folks understand that we are here for them?
Well, first, I just want to recognize the folks who shut down the 101 on Sunday. That is bravery. There are protests happening across the nation this week where folks who are targeted are standing up, and I think it's really important for us to go in and be in solidarity with them and show our support, because that is bravery. That is absolute bravery. I mean, driving a car on the 101 is bravery as well, but that's another story. You know, it really, recognizing our privilege and using it. You know, using the voices that we have, being able to amplify the folks who might not have the privilege or position, it's incumbent upon us to really take advantage of that, to use our station to lift up everyone and bring everyone with us. And to think about from the healthcare perspective, you know, for the providers in the room, you're interacting with folks on the regular, and you are able to hear their stories and share them with us in a way that we're able to bring real, true, lived experience to the policymakers, to let them know what the true impact is of the work. So I think it's really for the frontline workers as well to be able to be that conduit, to make sure that we're not losing sight of what's really happening and who is really being impacted. I do worry. We know 8 years ago, folks stopped coming for visits with their providers, right? They were afraid to enroll into coverage programs. They were afraid to drop their kids off at school. And now we've lost our sensitive location status, which makes it even more challenging. But we've got telehealth, you know, we've got promotoras, we've got folks going out into the community. And so to the extent possible, how can we engage and keep engaged with the folks who rightfully are afraid to leave their homes? So thinking about how we connect with them and bring those stories and elevate those as well.
I completely agree. I think the storytelling is something that we often miss because we're working hard, we're doing the work, but we have to tell those stories. And you know, I want to say there are two really important things that each and every one of us can do right now. Some of you may have heard of the website 5 Calls, right? Which is take 5 minutes to make 5 calls. We've already seen last week, right? Louise mentioned the change in the funding freeze, right? Why did that happen? Yes, I'm gonna give Rob Bonta a little credit, but you know why it really happened? Because the congressional switchboards were shut down because there were no messages that could be made after 2 p.m. because they were all full, where people were calling their members of Congress, their senators, and saying no to the funding freeze. So we have to keep doing that. Like, put in your calendar, set aside 15 minutes, maybe not every day, maybe just once a week, but put in your calendars to do that. The other thing I'll point to is know your rights, right? Using the privilege to share that knowledge. And I'll tell you that works too. And you know who said it works? Our new board czar, Tom Homan. He said on CNN last week they were not able to capture and kidnap as many undocumented folks. That's not his words, of course, those were mine. Kidnap and capture as many undocumented folks in the raids in Chicago as they had hoped and expected. Why? And he literally said, because too many people knew their rights. Just think of that. He's saying because too many people knew their rights. So that is what we have in America. We do have rights, but we need everyone to know them and to exercise them. So even though we may do healthcare work, we need our community members, have in each of your offices, have on your websites, know your rights. And if it's a card, if it's a QR code that they can go to so that they know that when somebody comes to their door or someone comes to their kid's school, that these are things you can say, no, no.
Thank you for that. And these are, yes. And I just want to underscore some things that have already been said. Know your rights. And to my funder colleagues in this audience, supporting points of connection for health, clinics and otherwise, of having the materials that they need so they can become points of distribution for the rights that we all know. The kind of public education that is critically important for folks during this time. The exercising of your privilege. You do, in America, still have the opportunity to raise your voice in disagreement. That's what shut down the switchboards. It was mass disagreement. I would even go so far as to say anger and fear about what the impact of that pause was going to do, not just to blue states or folks who have a more progressive position, but to America at large. And the third thing is something that was, I think, stated by the secretary earlier today, is that we are in this together. Reshaping false narratives about people's intentions, human dignity, and value by way of contributions to this country needs to be told and repeated. People who immigrate are not just criminals, are not simply here to take jobs. People are in search of a better life in ways that validate the power of the American dream. That's what attracts people. And we have to make that clear in our storytelling and how we connect and communicate with folks. And then lastly, and this is just a summary of what's been said, to really focus on the fact that as folks interested in the expansion of health coverage and care, that in today's market, that is insufficient if that is all you're doing, even to your own ends. That we have all got to be, even as tired as we are, more than we have been in the past. Because we are effectively in a fight for the future of not only California, but of our country. And I can think of few other groups, given the success you've seen in some of the slides that Crispin presented today, that is better prepared to engage in that righteous battle. I'll say before we start taking questions from the audience, as it was said that sometimes you feel like you are preaching to the choir when you're on a stage like this. But my mother used to always say when she heard that phrase, the choir goes to church for a reason too, son. And it just ain't to sing. That we need to say these stories back to ourselves so that we are strengthened for the battles that we have ahead. Now, I am told that we're going to take a few questions from the audience, and I am going to look for some support. And you really can't see out here, these lights. I mean, I can't see anything. But if we could get some microphones for the audience, and we have a few minutes.
There's someone right there.
But if we can, there you go. I think I have a question back here. Could you state your question and see who you'd like to be the primary person to respond to it? And then if there's other responses, we'll get to that.
Sure.
Please, and please identify yourself.
Sure, can you hear me? Oh, I feel loud. Okay. Hi, Lauren Panaccio, she, her, a pronoun series. I'm the Director of Community Health Transformation at a mission-driven consulting firm called Intrepid Ascent. My question is for both of you. I'm always really struck by the parallelism of the term, I hear myself like 4 times, by the parallelism of the term social determinants of health and political determinants of health. And there is so much investment in program innovations and interventions tied to screening and referral to support connection to resources to address the social determinants of health. And so my question for both of you is, can we, or how might we, if I can be audacious to assume that we might, galvanize the investment in social determinants of health interventions to extend to the political determinants of health so you can know your rights, know your resources, and use your voice? So I'm curious if that seems too audacious or if you've seen it in action.
We love audacious. You're in the right room. I think you hit it right away when you mentioned the social drivers. And I'm going to say drivers because I feel like they're not going to determine the end. They're just going to drive. We can always turn around. But screening first. We need to know what we're screening for. Are you registered to vote? Right? Do you know where your polling place is? You know, there's data about voting. You know, people who vote grew up in families that vote, right? So how do we make that happen? You know, how do we make sure that people are willing to read the news, to engage in, you know, it's so toxic. Is there a way that we can get things from behind the paywall, what you talked about, so that people actually have access to information and facts to know how to get engaged? So I think the key question, we know what we want to recommend. How do we screen for it, would be my comment. And if we can screen for it, then we can act on it.
So I'll mention a innovative approach that I think really addresses what you're getting at. In 2020, a group of Black scholars and others came up with this approach called radical healing. So this was to address racism felt by Black communities, and it went beyond individual or group therapy. What radical healing is about is changing the circumstances under which we live, right? So what it does, and we actually are implementing it through a project called HOPE, is that when we do workshops and we have group therapy sessions for individuals who've experienced anti-Asian hate, a key part of that is driving and promoting civic engagement. So I'll give you an example in the African American community. It's not enough when a young man who is stopped by the police routinely just because of his race gets, you know, therapy and psychological services, right, to process and unpack what's happening. He needs to be able to be part of that movement so that that doesn't happen to the next group of young Black men. And so the same thing is what we're doing in the API community, is we're promoting civic engagement to those as part of their healing to help heal all of our communities. So I will tell you a couple of things that came out of the first cohort. A librarian started a book club to promote and just help people understand the Asian American community, because she's a librarian. Someone else started a podcast in their community on anti-Asian hate. So they didn't just heal for themselves, but they sought to achieve healing for essentially all of us. And so that's what I would say is that, again, in your offices, you know, we saw this in 2020, put out a reminder about the census, right? That is civic participation, voter registration information, right? And you can ask a patient, hey, have you registered to vote? Hey, did you fill out a census? This is why it's important. And that helps to get from just the social determinants to then the political determinants.
We're going to go to the other side of the room. Question, please.
Yes, hi. Sabra Matovsky from Healthcare LA IPA. We're a health center controlled network in Los Angeles serving almost 750,000 patients. I'm particularly concerned as we're going into this new administration and some of the threats that we're under, in that we have a large number of patients that have come in as undocumented with substantial health needs. We've seen our cancer rates per thousand go up 26% in the last 18 months. And I'm wondering if there's the opportunity for funding to try and make sure that there are people that are holding the hands of people in the middle of things like cancer care who may be afraid to go. And I think we're really in a space where we have people in that circumstance. And I'm just wondering if there's an opportunity in terms of some of the quiet work we could do to make sure that people keep those appointments.
Luis?
First of all, hi Sabra. I can't comment to funding, but I can say we're going to get the band back together again. Remember the LA Safety Net Coalition, which was the precursor to Prop 35? LA Care convened health plans, safety net providers like the Medical Association, the hospitals, the health centers, and we were just talking last week, last year, I don't even know what days anymore, but we're bringing the band back together to have this conversation amongst safety net providers across our system to talk about how do we support our immigrant communities. And so that is coming soon. I can't comment to the funding side of things because it is something that system-wide we know is of concern. And so, you know, the health centers can do the Know Your Rights trainings for our teams, but what about the private physicians? What about the specialists? What about every single other point in the delivery system? So what I can say is that watch for your invite because we're going to bring the coalition back together.
Thank you. Back over on this side of the room.
Hello, good morning. My name is Camila Chavez, Executive Director of Dolores Huerta Foundation, based in the Central Valley. And so I have a couple of comments. And so I think the last comment was a perfect segue because there are a lot of do-gooders that are calling our office asking, what can we do, right? So we were the first to experience immigration raids. Well, then we learned that the food banks had a decreased attendance. So that's when we called those volunteers and said, hey, would you be willing to deliver food? We had people sign up who said they weren't able to attend, but they would like groceries delivered to their home or a park near their home. And it makes me think about a concept that I just heard of, right? The Know Your Rights. We know that's working. And then gatekeeper strategy. So could we also then create this network of volunteers who are willing to come to clinics to help, you know, escort, right, patients who maybe feel scared, shaming the agents. And they said just shaming made them go away, right? So whatever we can do, but I wanted to put that out there. Just like abortion clinics, right? They've had a very, I think, comprehensive volunteer network, right? Supporting people, you know, getting abortions in places that were dangerous, right? To do so. The other PSA is the news. democracynow.org, I feel, is a very well-kept secret for those of you that are looking to get unfiltered news, and it doesn't cost you anything. And then the other, just along the political note, is Working Families Party, right? They're trying to elect progressive Democrats. For those that haven't heard, Working Families Party California, look them up. Thank you.
Thank you.
Thank
you.
Can I make a quick comment?
Manju, yes, was as a response.
Thank you so much for those comments. I do want to just share something we did under the first Trump administration, and I think many of you, especially in collaboratives, could do the same. We hosted a workshop called What to Do When ICE Comes to Your Office. And I think that was really important for our 50-member organizations to know what staff can and should do, because we often tell our clients what they need to do or what they can do in their homes, in their churches, in their schools, but we don't necessarily know what we can do, and we should, because it's very, very possible that it could happen, and it helps to empower our staff to know that they can protect our clients and patients.
It's going to be our last question back here. Yes.
Hi, can you hear me? My name is Jamie Yan Farrow, and I think, how do I put it? I'm a consumer and also a student pursuing a degree in health and human services, completing my degree this year. So I represent partnership today, but I want to bring to your attention of those who are marginalized, BIPOC, peer, the underserved and unserved communities. You know, what you all say are very big, in big chunks. So is there any way we can find a platform to form allyship with the grassroots people, stakeholders in this equation? Those who have severe SMI, those who actually without a voice because the first language is not English, linguistically challenged, culturally stigmatized, those who have been attacked because of misinformation. I'm one of them during the first Trump administration. So I'm speaking of experience. I'm speaking of so many representations of my community. And right now, I represent the MHSA Council for Marine and Contra Costa. So what I'm trying to propose here is for leaders to think about having some manner that we can all form allyship. People can forget what you say, what you tell them, but they will not forget how you make them feel. I want Maya Angelou.
Yes.
I just want to say, it's because we are all so many of diversity here. Is there any way we can come together after this event has ended? Because it's not about to make you feel great, it's about also cringe in their uncomfortability. I'm going to have an event about that later on that I'm organizing. But long story short, my ask is that Maju and Luis here, and even Cret, I don't know if I pronounce your name correctly, but can we find some way that we can connect in a deeper sense? Because we cannot reinvent the view, there's no time, but we can put strategies inside what you have already built. Just because they are trying to do away the DEI. DEI is very important. DEI, diversity, equity, and inclusion. BIPOC, Black, Indigenous, person of color, and BAM, Black, Asian, multi-ethnicities. We are more than the word race on a demographic form. My first language is not English, so I'm still piggybacking, learning, but I would like to be able to connect with people from different counties to be able to bring allyship, because I'm going to do a summit this year. I've organized one last year for the state of California. I have 150 participants. That was my target. But in reality, there was 120 over people that came. So I see the need, especially for those who have mental health challenges or those who first language is not English, the diverse groups. We need to find a way to really build this from phase one, so that hopefully if I'm invited back next year, we can do phase 2 and 3, because we really need it, and I hope I can get some attention from, people who are like-minded to work together. Thank you.
Thank you. I want to thank our last two speakers for their comments. I want to give a quick chance for, because we're a little over, to respond, and then we'll close. Yes.
Sure. I just want to thank you for uplifting those two important points. So many in our communities are limited English proficient. Just in the AAPI community, 30% of Asians in California, which is 2 million people, are limited English proficient. So we really need to make sure that our materials are available, that they can access services. I wanted to also just end by mentioning what you uplifted, which is DEI. They are blaming everything on DEI. What does that mean? It means two things. Every person of color, every woman, every LGBTQ person will now be responsible for any bad thing that happens in America. We heard that about the plane crash, the first one, that it was because of DEI. That's just going to be their short form. But let's be really clear about what DEI is and what is the opposite of DEI. So what is the opposite of diversity? Segregation. What is the opposite of equity? Withholding resources and opportunities. And what is the opposite of inclusion? Exclusion. So that's what we're talking about. They want segregation. They want resources only for themselves, hoarding, and they want to exclude us from the rights and privileges and benefits of what America offers. So when we're clear about that and we work together, BIPOC communities, LGBTQ communities, for gender equity, for to end racism, for all of these different things, I think we can be successful, but we have to be clear and we have to bring all of us along together.
Luis?
Thank you for that. And it really points out the fact that they're attempting to weaponize our words, the words that we use to describe ourselves. So at CCLAC, we do Jedi because we want the justice in there as well. And I think that that's something as we go forward, beyond today, and to your point, is what do we do after this? What are the next steps? And so we can't come to Sacramento and have these very important, I feel like I should give you guys a copay for this, counseling sessions, but we can do things in our communities, right? Politics is local. It can be in your church. It can be in your neighborhood center. In Los Angeles, we've got wonderful, wonderful organizations like Community Coalition, Black Women for Wellness, so many others. Manjusha's organization as well. So it's really looking locally to say how can we get together and then build coalition of coalitions. So I think we need to make sure they don't use our words against us. We control the narrative, and that we continue to work together after today.
Sage advice for our panelists. We started in my opening remarks talking about the framework around the political determinants of health. So let's just remind ourselves that civic engagement, voting, is health, that public investment is health, and that the development of policy and the holding accountable elected and appointed officials is part of the health agenda as well. You know this. It always has been. Its importance is probably never greater than it is now. And if we act in allyship, collectively, making sure that tent is big enough for all voices to be included, we will win. Let's give a great round of applause for our speakers today. And I'm going to turn it back to Crispin. Thank you all.
So now, I know we're running a little behind. There is a short break. Actually, it's really short. So I'll ask you if you want to go out into the foyer. There'll be coffee and water, and if you want to refresh. And then we're going to start our breakouts soon.
you'll find them if you go out to the right and then to the left. They do fill up quickly in terms of sitting down. So if you want a seat, I recommend that you grab your coffee quickly and go find a seat. So thank you so much, and we will see you in the breakouts.